What is the link between obesity and chronic disease, and what other risk factors are associated with obesity? Anyone?
Well, obesity and chronic disease are very closely linked. Obesity, being overweight, is a cause or one of the factors in almost all chronic diseases, especially our main chronic diseases like heart disease. Also, it can be a factor in some cancers. And there are other risk factors that are associated too, like sleep apnea, which I'm sure everybody's been hearing about a lot lately, that goes hand in hand with being overweight. Stroke is another one, and you ladies might have a few others.
Go ahead.
I was just going to say, with my perspective from Be Active, we often say that if exercise came in the form of a pill, it would be the most widely prescribed medicine for everything. It's linked to so many different types of chronic disease. Another, type 2 diabetes, which is on the rise in kids. It used to be called adult onset diabetes. We can't call it that anymore because our kids are starting to develop it. And physical activity and good nutrition can combat that without having to take medicines or change things. It's something that can be rolled back, as with many of the other chronic diseases, high cholesterol, blood pressure, some mental health levels can be improved simply by being active and eating well.
And one of the messages that we like to put out there is it's not just about obesity. So someone can be very thin and look like they're fit and really not have a healthy diet and really not exercise. So the way someone looks and their body weight is not always a good indicator as to whether or not they're healthy. So that's a message that we really like to try to get across to folks.